Just a minute or so. Well, is there a doctor in the house? Many Medicare patients are finding out the answer to this question is increasingly becoming no. Doctors facing massive cuts in reimbursements are actually starting to drop Medicare as an accepted form of coverage. Joining us is Cecil Wilson. He is the president-elect of the American Medical Association. And Mr. Wilson, thank you so much for being on with Fox Business. I have to ask you, we are hearing more and more reports from around the country that doctors are dropping Medicare patients or refusing to take in new Medicare patients. How bad is this trend?
Well, first, thank you for having me on, and let me just comment that physical activity is a good thing. We recommend it. We are facing a real catastrophe from Medicare payment because come June the 1st, unless something is done, doctors will face a 21% cut in payments. But that's a part of a story that goes back over the last 9 years, that payments to physicians for Medicare have not kept up with the cost of providing care, and that's at a time when costs have gone up some 22%. And the payments have, at this point, only cover about half or 50% of the cost of providing care. So increasingly, physicians are having to make those gut-wrenching decisions, which says just cannot afford to continue seeing all the Medicare patients that I would want to see. And we've seen signs of that over the past several years. A survey last year by MedPAC, the Medicare Advisory Board, which found that fully a fourth of seniors who are looking for a new primary care physician are having trouble finding one. A recent survey in Idaho by AARP, which showed that fully 1 in 5 physicians are not taking any new Medicare patients. This system, the lack of Congress paying for the system, is putting seniors at risk, as well as military families who rely on TRICARE for their insurance.
Mr. Wilson, it's Greg Jarrett. Your organization, the AMA, endorsed the healthcare reform legislation. Won't that make matters even worse by essentially adding tens of millions of people to programs now which doctors will be overwhelmed in handling?
Well, let me just suggest that providing insurance for more people so that they have more access to care is a good thing, and we are fully in support of that. But if doctors can't handle it,
there isn't going to be good access.
But we would also agree that we already have a shortage of physicians in this country, and that adding more people who can get access because they have insurance will present us with challenges, which means we need to expand the workforce, and we know that takes years. But if the alternative is not providing care for those people, I personally think that that's unconscionable. So it's going to be rough going for a few years, but it is a responsibility that we've assumed as a society to help those who cannot help themselves.
Well, but hold on. I mean, here's the thing. I mean, Congress has always delayed the reimbursement cuts for doctors. You're asking for yet another delay. You say that it's a cost issue, but it actually would increase the cost to the taxpayer a year from now if this 21% cut for reimbursements for doctors goes into effect. It would be 25% next year. So how do you respond to that?
Well, first of all, we're not asking for a delay. What we're saying to Congress is fix the problem. And the problem is the reason physicians have been faced with cuts on an annual basis since 2001 is we have a flawed formula that calls for these cuts. And as long as Congress does a Band-Aid, all they do is make the cost higher.
Okay, we've got some problems with Cecil Wilson. If we can get him back, the president-elect of the American Medical Association. And Mark, you've been listening to the interview, and I know you had a question for Mr. Wilson, but your thoughts so far?
As I listen to Dr. Wilson, I think one of the big issues here is, at the end of the day, how do we reduce cost of medical care? We passed this legislation just last month, and one of the issues that we didn't deal with is increasing the cost. We didn't deal with duplication of services. We didn't deal with appropriate utilization of services. We didn't dealing with increased premiums. And those are major issues which have to be dealt with.
The cost issue is important, but also, I mean, the fact that, let's just talk about these baby boomers that are coming into the Medicare system. I mean, this increase is going to be hefty year after year. And these doctors, I mean, I have doctors right here in New York City telling me, I will not take a new Medicare patient. And then you've got several physicians groups in this area and other parts of the country that are just dropping Medicare patients completely.
And I tell you, I've heard the same thing. And musings from doctors who say, I can't afford to even practice medicine anymore. And they're looking at other alternatives. So Dr. Wilson is talking about increasing the workforce of doctors, but he's going to have to grapple with a simultaneous reduction in the workforce.
All right, we want to apologize for our technical difficulties. Dr. Wilson, president-elect of the AMA, was with us. We're going to take a break. When we come back, folks,